Human body. A perfectly balanced system able to withstand any stressors it can face. But then, where do disorders come from? This is what we learn from pathology, a subject that will help us understand the causes and logic of disorders. It studies how our perfectly balanced system can be destroyed. So, where do illnesses come from? It all starts from the cells. When your body encounters stressors, it responds with adaptation and rearrangement in order to maintain balance in the face of these new stressors. There are several ways your cells can adapt to these changes. Hypertrophy. Increase in cell size, as well as an increase in cellular organelles and protein production. Cells are getting stronger in response to higher levels of stressors. For instance, lifting heavier weights leads to muscle hypertrophy. This is a good example of physiologic hypertrophy. But what if you have hypertension? A condition that makes your heart pump against higher resistance and tightened blood vessels. It will give you cardiac hypertrophy, a pathological condition that decreases the size of the ventricles. Hyperplasia. Increase in the number of cells in response to a stressor. Usually, only rapidly dividing cells are prone to hyperplasia. For instance, calluses on the hands typically appear after prolonged pressure is applied. Antibodies affect TSH receptors, stimulating the thyroid gland to work more and leading to its hyperplasia. The inner layer of the uterus, known as the endometrium, grows in response to the hormone estrogen. It typically occurs within the first 14 days. After ovulation, progesterone maintains the stability of the endometrium for the next 14 days, followed by loss of cells. But what if there was a delay in ovulation, and estrogen exposure was prolonged? This means that this time, the endometrium will grow a lot bigger, and the next menstrual cycle will be more painful with increased blood loss. Please remember, hyperplasia increases the chances of having cancer, since the more you stimulate cells to increase in number, the more likely it is that some cells will undergo mutation. So abnormal uterine bleeding is associated with cancer. There's only one exception to this rule. Benign prostatic hyperplasia does not tend to turn into a malignant version.